So aromatherapy is basically using essential oils to help with some symptom management for patients and to bring about a desired effect. So, and essential oils are basically a distillation of plant-based materials, leaves, flowers, roots. They're highly concentrated, so they should be used with some care, and they should be used with people who do know a little bit about the use of essential oils. For the most part, is using essential oils with your patients is just like with any other medication that you're going to give a patient. You really want to learn a little bit about each essential oil and what it's used for and some of your side effects or contraindications. Just because it's natural doesn't necessarily mean it's safe or it's without side effects. For example, one of the most common essential oils that's used for inhalation is lavender. And if you look and do some research on lavender essential oil, it does have an estrogenic effect. So it could be detrimental in a breast cancer patient's use in a breast cancer patient. So that would have to have what we would call almost a shared decision-making visit or discussion with your patient about those risks and the benefits of what that lavender essential oil could do for you. We have a lot of different essential oils out there. Most of the time, if we're just inhaling them, that's wonderful, but also just knowing some of those contraindication. We want to make sure they're 100% essential oils and not a synthetic fragrance oil. Those are great if you want to, just smell like cookies, but when we're using something for therapeutic use, we want that 100% essential oils.
And do you make these diffusers and other products available? Do the nurses call you, or how do they get
So I
available?
have been called by either the providers that know that I have some holistic and integrative background about a patient who may have excessive nausea. Every time she comes into the infusion room, and it could be just that anticipated nausea because they know, and then I go and talk to them, make sure I find out their allergies and any other health history, and then we can talk about, well, a little peppermint essential oil might help. Just sniff this when you're feeling nauseous, or even a little ginger essential oil can help. Because I was certified through the American Holistic Nurses Association as a holistic nurse, I do not recommend the ingestion of essential oils. It's really the best way to use that for a desired effect is inhalation, because as the person inhales that goes into the respiratory system and also through the olfactory gland. So you are getting active constituents of those into your system. And so I would definitely, if somebody was interested in learning more about essential oils, look up essential oils. There are so many resources available for you. Many of the larger oncology facilities do have information on essential oils, not only for patient use, but healthcare professionals to be educated on them. And I would also reach out to, again, the National Center for Complementary and Integrative Health, NCCIH. I think I got that right. And learn a little bit more. And definitely just talking to your patients, finding out what they want to use them for, and then being able to have that conversation with them.